Neutering a male dog involves removing the testicles, along with associated structures, which are responsible for sperm production and testosterone production, while each veterinary clinic has its own routine. A neuter surgery typically involves pre-operation preparation, the surgery, and then recovery. This is a surgical procedure that can only be performed at a veterinary clinic. Home removal can kill a dog due to blood loss or infections. It's important to note the benefits of neutering, the steps involved in the surgical procedure, and the procedure after the surgery. So, we are going to watch about the how to neuter a dog.
Method 1. Getting your dog neutered.
First is understand why it is important to neuter your dog. There are 3 main benefits to neutering a male dog. These include a decrease in unwanted puppies, medical benefits to the neutered dog, and a reduction in negative behaviors. Step 2. Make sure your dog is healthy enough for surgery. Proper feeding, exercise, and vaccinations will go a long way to ensure your dog is as healthy as possible. You need to make sure your dog is healthy enough to undergo anesthesia, as it will be sedated and under anesthesia.
Step 3. Schedule the surgery.
You will need to call your veterinary clinic or hospital to schedule a surgical appointment. They will give you their pre-operation protocol, which generally includes withholding food the night before surgery.
Step 4. Bring your dog in for surgery.
When you bring your dog to the veterinary office the day of surgery, your dog will be weighed and examined to make sure it is ready. If so, the dog will then be prepared for surgery. This generally includes giving a sedative, placing a tube down the windpipe, putting.
Finally, understand what is involved with the neutering surgery.
The operation itself is straightforward. An incision will be made either directly in the skin on top of the testicles. The anesthetic gas will be turned off and the dog will slowly awaken from the anesthetic.
Method 2. Caring for a dog after surgery. First is take your dog home.
Follow your veterinarian's advice about follow-up checkups after the operation. Give all medications for pain as instructed. Be gentle with it and give it some love and care.
Step 2. Keep your dog as calm as possible.
For the first 24 hours after surgery, most dogs are quiet, as they are groggy from the sedation and anesthetic. For up to a week after the operation the dog should be kept reasonably quiet. No vigorous play, running, and dry. No swimming or bathing.
Step 3. Check the incision site twice a day.
The incision should not gap nor bleed. The skin should be pale, or the normal skin color. In light-skinned dogs you may see some light bruising as well. Finally, keep your dog from excessively licking the incision site. If you catch your dog constantly licking the incision site, it may need to wear an Elizabethan A collar, or the dreaded cone. Licking can cause the wound to open, leading to a chance of infection. Most dogs recover uneventfully from the surgery.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.